Let's look at a few important concepts. The concept of field cancerization. The definition is the presence of submicroscopic genetically altered cells in a large area of tissue surrounding a tumor. This explains why a surgeon might have clear margins on histopathology, yet the patient develops a second primary tumor in the same area. It is common in head and neck and bladder cancers. Next concept is the epithelial mesenchymal transition, or EMT. This is a high yield topic. To migrate, epithelial cells must lose their identity. The transcription factors involved in it are snail, slug, and twist, and the markers are downregulation of E-cadherin and upregulation of vimentin and smooth muscle actin. Next one is the seed and soil hypothesis. Why does prostate cancer go to bone? Why does bronchogenic carcinoma go to adrenals? It's about chemokine receptors. For example, CXCR4 on tumor cells seeking CXCL12 in the soil.